Not every birth defect can be prevented, but a mother can do her best to make sure her baby is completely healthy. I'm Dr. Anthony, I'm a pediatrician, and I will talk to you about it. If any defect or abnormality is found in the child at the time of birth, then we consider it as a birth defect. It can be linked to any system. Whether it is due to the brain or the nerves that come out of the brain, or any heart disease, or if there is any abnormality in the hands and feet, they all are considered birth defects. It can be linked to any part of the body. Sometimes it is related to the entrails. Some diseases can also occur in the kidneys. This birth defect can be found in any part of the body. I just now said that birth defects are those defects that are found at the time of birth, but it is not necessary that all birth defects should be found at the time of birth. Nowadays, technology is so advanced that we can diagnose many birth defects in advance, especially because nowadays ultrasound is very common. A mother can detect many birth defects early by getting her ultrasound done. These birth defects affect the child in different ways. As I said earlier, we know about around 4,000 types of birth defects, so some of them do not affect the child. They have no effect on the life of the child. For example, sometimes two fingers of a hand are connected, so this does not affect the life of the child. But there are some birth defects which can be very dangerous to the life of the child. For example, there are some heart diseases, some heart birth defects. For them, if the operation is not done immediately within the first few days, then the life of the child can be in danger. There are some diseases of the brain too for which surgery is urgently needed in a newborn. When a mother is planning her pregnancy, it would be better if she meets her doctor so that if she has any disease or deficiency, she can treat it beforehand and it does not affect the child. Along with this, many times we wish that the mother should start taking folic acid tablets so that the child's brain is not affected by folic acid deficiency. Folic acid is a medicine that should be started before pregnancy. This has a good effect on the brain and spine of the child, and there is no problem in it. But it is important to know that it should be started before pregnancy and not after detecting the pregnancy, because by then many times it is too late. Our questions are over and this glass of tea is also about to finish. As we all know, this glass of tea can be refilled and there is no need for us to be disappointed. Similarly, I would like to say that there is no need for the mother to be disheartened because almost every birth defect can be completely treated.